Welcome to the first podcast for Cereset Davidson. My name is Julie Martin. I'm a licensed clinical mental health counselor and also a certified sex addiction specialist. Also, I am the owner of Cereset Davidson, which is a neuromodulation technology that I am so excited to talk about today. I'm especially excited to have Dr. John Reynolds with me today. He has been in the field of neuroscience for 40 years. He's a neuroanesthesiologist who specializes in monitoring the brain during surgery. He's won teaching awards at 3 different institutions and has been named to Who's Who among America's teachers and to Best Doctors in America for the past 20 years. So welcome, John.
I'm very happy to be here.
Thank you. When we met, I was particularly excited to know that you were a teacher. So you've got all of this scientific knowledge that goes beyond what most of us can explain, but you also have the ability to explain it in layman's terms. So that was very exciting to me because I get questions over and over again that I'm not sure how to answer. So I'm just going to throw out some of the most common questions that I get and have you take it from there. So the first question is, what is Cereset?
Well, Cereset is it's a revolutionary new non-invasive way to really allow your brain to recalibrate itself.
Okay, so how does your brain get unbalanced in the first place?
Well, usually it's some form of continuous or significant stress, which in turn leads your brain to reset how it handles its protective responses.
Okay, can you tell us more about protective responses?
Well, your brain is really the primary regulator of your survival. You know, in the end, you have any threat to your body that causes you to want to fight or flee or freeze has to be done so quickly it's automatic. Mm-hmm. So the neurologic system that handles that is called the autonomic nervous system. You know, we've all felt our heart race or our heart pound because of small frights or surprises. That's your brain getting all these things started in the first place.
Okay. And so your brain can reset.
Well, your brain's going to adapt to the environment it's in. If you live in an environment that has a lot of strain or stress, your brain's going to gradually adapt and reset towards that side of your brain that's going to help it respond more quickly.
Okay.
So interestingly, there's a sidedness to your brain on most every level. And we've known this for a long time, but even these most primitive responses have a sidedness. So like your fight or flight sympathetic response is your right side. And your rest, digest, and freeze response is your left side. That's called parasympathetic.
Okay.
These two are supposed to be balanced. They're beautifully balanced and designed to be balanced. And if everything's going well, it is.
Right.
But if your environment is such that you have to do one or the other too frequently, your body's going to respond and adapt and move and reset to where it's able to handle those stresses more quickly. It's a survival response.
Okay.
Now,
Great.
Unfortunately, sometimes your environment shifts and you don't. So you can get stuck at a right-shifted fight or flight or left-shifted freeze response. You can get stuck there even months, years after your environment has changed.
Okay. So that's probably what we're seeing with the epidemic of anxiety, panic disorder, things like that.
I think that's a big part of it, for sure. I mean, it's hard to know with every individual. You know, I think you'll want to interview them. But for the most part, I think people in our society today have a lot of stress, a lot of continuous strain, and your brain's designed to protect you. And it's going to adapt to make the hardest, most dangerous things manageable. I think everybody who gets to adulthood has had some time in their life, maybe numerous times in their life, where this system has saved them. It kept them from harm or worse. So we should be grateful it exists.
Right.
But sometimes it's too much of a good thing, and it stays fixed to this survival mode. Survival kind of trumps everything else in your body's wiring. So you can get stuck too far to the right or to the left if your environment has produced that.
Right. Okay. That makes sense. So how does Cereset work to recalibrate this back to a balanced baseline?
What Cereset does is they measure your brain waves, and immediately the frequency of the brain wave that's most dominant is reflected back into your brain with an auditory sound that's the exact same frequency. So it's a very powerful computer program that reads this frequency that's most dominant and then sends it back to your brain immediately in milliseconds. Every 25 milliseconds, it updates. It's incredibly powerful, incredibly high tech. But what it does is it reflects back this dominant frequency to your brain. And what that does is that soon after the sound gets into your ears and moves down the 8th cranial nerve into your brainstem and starts the neural oscillations of those neural elements, it starts the neural oscillations that lead to the nearby nerve elements similarly moving and similarly oscillating. And the brain has an innate desire to get itself back to baseline. So Cereset is just helping the brain find its way back to baseline by providing this high-resolution, resonance-based, relational, electroencephalographic mirroring. Okay. That's the term they use called HIREM. There's a lot there, but in general, the resonance that's being produced by these neural oscillations is getting nearby neural elements to free themselves up or to what they call accrete, which would be to grow new neural elements, whatever the brain needs to get itself back to baseline. It's really just stimulating a healing or recovering process if your brain has been pulled too far to the left or right because of strain.
Okay. So since it uses sound, what do you think about the apps that have like relaxing tones or maybe water running? Like what makes Cereset different to listen to your own brainwaves versus just these generic tones?
Well, I think listening to babbling brooks and things is very pleasant. But in general, what's beautiful about Cereset is that these aren't tones per se. In general, the tone you're listening to is actually the exact frequency that your brain is sending to the computer. So it's not listening to musical notes that are random. It's really mirroring your own brain back upon itself to get things moving, to get the neural elements moving, and to get those nearby oscillating to the point where they can return. So once you start dealing with pleasant sounds and music, you're back up into your cortex. You're up into your thoughtful, conscious brain, which is nice, but it's much, much slower and is not able to accomplish the vast amounts of work that you can do by just working down in your brainstem. The amount of speed and processing that can be done with white matter, brainstem wiring versus your cortex is orders and orders of magnitude, thousands of times different.
So that really speaks to, like, as a therapist, why, cognitive behavioral therapy is useful. Let's examine what you're thinking because our thoughts produce our behavior. But, when we're talking about anxiety, people are having these responses that they're not thinking anything. They're sitting in the middle of church and all of a sudden you have an adrenaline rush, like someone is holding a gun to your head and there's nothing happening. That's very difficult to with cognitive behavioral therapy to be able to calm people down in the moment.
That's an immediate response. That's a reflex. That is so fast. There's no thinking around that. And talking about it is great. And maybe it might help with coping mechanisms once they occur, but it's going to be hard to change the trigger because that trigger is immediate. It's your basic foundational survival systems. And that is too fast to have conscious decisions involved and always has been.
Right.
So I think using a therapy that's at that higher cortical level of thought is not going to change how you respond to triggers that get your heart racing, that get you panicking, that get you anxious. You have to kind of get back down to, to use a computer analogy, down to the hard drive and work on the wiring there and debug it by providing this therapy that seems to work right on the basic elements as opposed to talking about it. Some of these biofeedback mechanisms have been used for a generation. They've helped a lot of people, no doubt, but they require you to learn. They require you to try to change your physiologic responses and try to move you towards some physiologic norm that's set. Cereset does none of that. There's no learning involved. You just lay there in the dark with your eyes closed. Okay, there's no learning involved. You don't have to adapt your own physiology at all. You just let your brain do its thing and let the computer that's providing frequencies that are tones that are the same that it's presenting. You let that get to work. It's really night and day different. It's the speed involved, the amount of processing your cortex can do is like 12 to 40 bits per second.
Okay.
Whereas your brainstem can do millions
Right.
of bits per second.
So that is a game changer when you're comparing Cereset to neurofeedback. It's just the process is much quicker.
Right. In my world, I'm a neuroanesthesiologist, and I'm always trying to separate the cortex from the brainstem. In talking to the people I'm teaching about this, there's a big difference in those neural elements. The cortex is where your humanity sits. It's who you are. It's wonderful, but it's slow, and it's sensitive, and it's delicate. And your brainstem is not.
Okay.
It is fast and strong, and it keeps your heart beating and keeps you breathing through great stress and strain. They're two extremely different systems, and Cereset works low. Even though it's on the cortex, it quickly gets down to elements that are reactionary survivals.
Okay, great. Now, this is a question I get quite frequently. Can it hurt me? Is it going to make me worse?
Absolutely not.
Okay.
Absolutely not. It's extremely non-invasive. It's just headphones in your ear and sounds. All medical instruction begins with the first do no harm mantra. Just laying there and getting sounds put into your ear is not going to hurt you. All it's going to do is help you with your coping mechanisms. And some people, may feel different because they're grateful, they feel better, but it's not going to provide any harm whatsoever.
Okay. So no personality changes. It's not going to, I had somebody worried that it was going to change their affect and take their feelings away. Another guy was worried, he was a musician and was worried it was going to affect his creativity. So nothing like that.
Well, those are all good questions, but here we're talking the gray-white difference again. The fact that Cereset does not have tremendous impact on the cortex, it's not going to change who you are whatsoever. It's able to get deeper than that quickly and work on those very powerful, fast subcortical pathways that are going to provide a much more rapid improvement in symptoms than your personality or your cortex.
Okay, great.
So for people that might be watching this who haven't done this yet or know anybody who has, just tell them what they're going to experience the first time they come and meet you, and then have a first introductory session to Cereset. What does it look like?
Great question. So they would come in and we would ask them a series of questions, have them rate from 1 to 10 how satisfied they are currently with their mood, sleep, stress management, energy, and thinking abilities. And then I would do a baseline 2-minute reading and be able to show them where they are in managing stress, how out of balance are they. They will actually get to see this, and it usually is very validating for people. They come in, they're scoring, I'm a 2 on stress management, and then they see that their T4 is imbalanced off the charts. Okay, well, that makes sense. And so it's very validating for them to see in a chart form, yes, your brain is very unbalanced. And then we go through and I explain what that means in the emotions and in the temporal lobes. And then I place the sensors in 4 different areas on the head. And these sensors are going to read 48,000 brain frequencies a second, translates them into tones as they listen to that with headphones and relax in a zero gravity chair. So a lot of people fall asleep. It's very relaxing. I shut the lights off. I leave the room. So it's basically the easiest appointment. When teenagers come in and they're like, I don't want to do this. By the second day, they can't wait because they know they're just going to get to sleep the whole time. They're not having to answer questions. As a therapist, they're not having to tell me their problems, or figure out why they do what they do. They're just laying in a chair, relaxing, taking a nap.
The 48,000 per second is just mind-blowing. Yeah. So in the neurologic monitoring realm of the last couple generations, we were happy to get to 4, 8, 16 frequencies.
Wow.
Full EEG. You might have 8 or 16 on a side. To talk about thousands of frequencies at the same time, that's the quantum leap that Lee Gerdes took with this technology to be able to just look at so many frequencies at once, and for it to be so, with regard to the patient, non-interactive.
Right.
I mean, most people are happy to lay in the dark in a chair and fall asleep there. You know, I know people that look forward to these appointments when they come. You know, even if they come back every few months or whatever, they say, okay, well,
yeah,
I feel so good when it's over, and it's certainly painless to do.
And that also speaks to like being a trauma therapist. There's a lot of people that either can't remember their trauma or they don't want to talk about it. And so the beauty of this is we don't have to do either. You're just relaxing in a chair. Your brain knows what it's been through and knows what it needs to do to rebalance. And it just makes that not necessary. So
I think that's a really important point to touch on, because what I've seen with people with anxieties and PTSD and traumas is that many of them have no recollection. Many of them don't remember. Now, it might be because it was extreme, or it might be because it happened so early in their development. You know, one of the things we were talking about earlier is that, you know, in those first months of development, it's your right cerebral cortex that forms first, which is connected to your sympathetic system. And if for some reason it doesn't form the way it's supposed to because of parental bonding issues, love, affection, etc. What happens in those first weeks or months of life that's supposed to? If it somehow doesn't form the way it's supposed to, then your sympathetic nervous system might have some degree of imbalance, or it might not form properly, and that can lead to emotional issues going down the road. And a whole lot of adults have anxiety issues and have no idea why. When it happened. Not everybody has that event.
That's so true.
Right? I think that's actually probably, you would know more than I, but it's probably minor when people can actually say, I had that event when I was 7. Or I think a whole lot of people have serious autonomic disturbances from a pre-memory time, whether it was in their first months or years of development before they can recall. Right. I mean, and it's nice to know you don't have to bust that out. Right. You don't have to talk about it or go try to find it. It's not stressful for the person who's sitting there. They just have to close their eyes and fall asleep.
That's true. So what does it look like when someone is too imbalanced, let's say in their temporal lobes?
Well, if you have been in an environment with too much stress, your body's going to adapt to the stressor you're in. And so if it's a fight or flight environment, you're going to gradually shift to the right so that those responses are easier. And so it's a protective mechanism. But unfortunately, now that you're right shifted, your body's going to have all these other downstream effects, right? You're going to have a higher heart rate. You're going to have a higher blood pressure. You're going to startle. You're going to have more cortisol surges. It might start affecting your immune system in a negative way. I mean, there's a lot of downstream effects of being, wired to the fight or flight response. And you and I have both seen people get that returned to normal. And it's so powerful when you get rebalanced and get back to where you're living in a balanced way, and your heart rate is in the 60s where it's supposed to be, and you can take deep breaths. Those things are wonderful. And if you've been in a challenging environment for a very long time, you don't even know what you're missing.
I had one that stands out in my mind was he actually called me a few days after his exit session and said, yeah, I just have a question. What am I supposed to be thinking about? And I said, I'm not sure what you mean. He's like, well, I'm used to ruminating thoughts. I'm used to, thinking a million miles an hour. What am I supposed to do now? Because it's just silent. And I said, you just enjoy life, buddy.
That is exactly what I've heard as well. I've heard that from numerous people, and that's the term is rumination.
Yes.
If rumination strikes a chord with you, it's not normal and needed to be. And I've heard the same things from some of your customers, that the rumination has gone. The reason I'm here is mostly as a testimonial from seeing so many people helped by it. And I've seen heart rates drop 30 points. I've seen people being able to take their first deep breath ever.
Wow.
Didn't know they could take it. Couldn't take a deep breath. Finishing yawns. What's a yawn? There's people out there that don't know these things because they're living in a state of anxiety or stress that's extreme. And you don't know what you don't have until if you didn't remember losing it.
Right.
And I think the anxiety state that many people feel, I think a lot of them don't even notice it because they've adapted to it.
It's what's normal for them. So who do you think would benefit most from brain optimization?
Well, from what I've seen is that it seems to be the people that had a normal balanced set point at first that was altered by some degree of stress. People that have PTSD or anxiety or insomnia. They have normal brain functioning, but they've had a reset set point. They're the people that I've seen have the most immediate, rapid results and near complete cures quickly, as opposed to trying to work around injured brain tissue. Now, Cereset definitely helps people with brain injuries of all sorts, but it's not going to be as fast, as complete, and as thorough as somebody who has completely normal functioning tissue everywhere.
Right, that makes sense. Okay, so what other compelling things have you learned about Cereset?
Well, like I said, I'm mostly here as an informed testimonial because I've seen so many people benefit by it. What I've learned looking deeper into it is that the neuroanatomy is so beautifully designed. And even recently, we've learned that there's connectivity between your brainstem and your cortex that's a straight shot from your sympathetic nervous system and your parasympathetic nervous system right into your cortex, the insular cortex. We've learned this recently, 2005, Bud Craig. Really, really amazing to have that shortcut that gives you that instant information. Normally, you have to go through the thalamus and relay. That's going to slow things down. So to see just how quickly and elegantly we can deal with our emotional responses on each side of the brain. That's one thing I've noticed. Another thing I've learned over time is that when doing brainstem evoked potentials in the operating room, we see very quickly that when you provide a single stimulus into one ear, you hear it on both sides immediately. There's a trapezoid body, it's called anatomically, that makes sure that you hear immediately. It gives you stereophonic sound. It's how you recognize where sounds are in space, because very quickly they go to both sides of your brain. And so to know that even though you may only hear something on one side, it goes to both sides quickly, I'm certain Cereset must go through the trapezoid body dramatically because it uses the acoustic system to provide balance to both sides. That's kind of something I've been working with my whole career. And I said, there's no question this must help very quickly provide some degree of harmony and balance by you going through that trapezoid body.
Okay, great. So are there any aspects of Cereset that are reinforced by your training as a neuroanesthesiologist?
Well, I think the main thing that I was going to mention with regard to this is the fact that it uses the acoustic system. Okay, I think originally Lee Geerdes wanted to use the visual system. We've learned similarly that the visual system is hard to use. It's got a very narrow range, and it goes across gray matter. Most of the pathway runs across your cortex, and that's much more sensitive to changes in blood pressure and oxygen and medicines, et cetera. Whereas the acoustic system is down in the brainstem. Most of it runs through your brainstem. It ends at the cortex at the very end in the gyrus of Heschel, but 5 of the 7 waves are right there in your brainstem. And so it's got an organ of Corti there that handles frequencies that are on a logarithmic scale. Thousands of different frequencies can be detected by a logarithmic scale the way you hear. So the range available with the acoustic system and where it runs and anatomically its proximity to autonomic centers, I think both Cereset and intraoperative neuromonitoring for now generations has kind of learned that the auditory system is high resolution and robust and reliable and powerful, and the visual system unfortunately is not.
Yeah.
Because, it's because of where it runs anatomically and its range.
Okay. So how does this stimulate the brain to create new neural pathways, and what can clients do to help support that process?
So this gets back to what we were saying about the resonance, is that once you provide the frequency back to the brain, that it's creating itself. So the brain has all its own frequencies, and the computer detects what's dominant this moment, and it bounces it right back to it. So it's a mirroring and echoing. It bounces it right back to it, and it gets it moving, and it gets it what they call oscillating. And as it oscillates, it provides the stimulus to what's around it to similarly free itself up or even grow. So I said the terms are dissipation and accretion in the literature, but that gets to the neural elements moving back towards a baseline. This is all built in the understanding that your brain is very powerful and wants to get back to baseline by itself. And this just gets those neural elements moving so that you can get neural growth or dissipation, whatever it takes to get your baseline back to a balance.
Okay. And so what happens when your brain is back in balance? What does that mean? Why is that valuable?
Well, when you get back into balance, you're going to have a very different reflex response to strains and stresses. So if you have trouble with startled responses, or if you overreact to benign stimuli, that's going to go away.
I think we need to get all teenagers in here.
It's going to go away. It's amazing. It's amazing. Just because those reflexes are so fast and non-cognitive that people just have adapted to the fact that they are high-strung or startled, or they're just wired high. And like I said, their heart rate might just live at 95. That's just who they are now. But when you reset all that and get back to a healthier balance, your life, you're going to see your life very differently, and you're going to be able to handle stresses and strains in a more rational way.
Okay, so I think what people probably would be most interested in hearing is, what have your experiences with Cereset been? Like, what have you seen?
Well, I've seen several remarkable recoveries, which is why I'm happy to be here. I have several friends and family members who have benefited greatly from Cereset. A few examples: I had a friend who was a catastrophizer. Every little stress or strain in her life was going to be the end of the world as she knew it, and it's going to affect their job and their place in society and their marriage, and everything would go right to the worst case scenario immediately. Obviously, some anxiety component in there. I'm no psychiatrist, but it was pretty clear. And in one round, that's gone. It was gone immediately, and it stayed gone right away. It's very impressive.
Yeah, it's amazing.
Another, you mentioned teenagers. I know a teenager, adolescent boy who didn't handle disappointment very well, especially on the athletic field, would tend to crash out a bit when things went sideways, to an extreme degree, to where he was getting in trouble and having serious repercussions. Cereset fixed that immediately.
Amazing.
Immediately. It's incredible. Yeah. I mean, this adolescent still finds disappointment on the field, and if he strikes out or makes an error, it's handled in a rational way. Asked him about it. What's up? And he said, it's just gone. The feeling of whole body rage that welled up immediately is gone.
The overwhelm.
It was really, really powerful response in a kid.
Yeah. So now he's got choices, it sounds like, where before it felt like he didn't have a choice.
Right. It was immediate, and it was usually extreme. I'm a baseball coach. I see a lot of this. I'd rather be coaching baseball most of the time. But so when you see these ridiculous responses that are over the top, there's something more to it than cognition. It's a baseline reflex. And so to see Cereset fix that, and it's been gone for good, is powerful. I have known another lady who midlife, strong starter reflex, insomnia, stated anxiety. Cereset worked on her immediately. Her baseline had extreme findings in both directions, depending on the place in the brain you were looking, and it fixed all of that immediately. In fact, she said her baseline heart rate was in the 90s for her whole lifetime, and now it's in the 60s.
Wow!
And she had, I mentioned it previously. She had never really taken a deep breath before and didn't know what it was. And now she's able to run and exercise and do endurance things she never could do before. I mean, even as a kid, she says she was an athlete, but she only sprint. All she could do is sprint. And that's kind of said her whole life was spent sprinting. But I think that was because of her reset of where her autonomic nervous system lived, and then it kept her for the ability of taking deep breaths and oxygen loading and handling endurance, and didn't have any endurance. So I mean that was remarkable to see that, and it was immediate. One round and all that was gone, and it's stayed gone for months now.
I mean, I tell you, if I hadn't seen these stories over and over again, it just sounds too good to be true, right? Like, how could just relaxing in a chair in a dark room, listening to these tones make such a difference. But as you have mentioned, we've seen over and over and over again just the game changer that Cereset is.
The revolutionary term is not overstated. And I think when Lee Gerdes figured this out, I don't think everybody quite understood just how substantially new, different, and powerful it was. Because we've been doing forms of neurologic monitoring for generations and having some benefits, but to have something that this powerfully taps into, his background was mathematics and computer science. So to take that strength and bring this technology into neuroscience, like I told you when we first met, I've been waiting 30 years for this. I started studying this in 1984. And to see what we were waiting for and to have somebody figure out the technology to help us tap into these systems that have this kind of speed and power was literally, I've waited my whole career for it. I didn't think I would live long enough to see it. So it is dramatically different than other things that use your cortex and involve your decisions. So it's nice to not have to do that.
Right.
It's really nice to just be able to lay there in the dark and let it do its thing.
Right.
But it really was the technology involved is remarkable. And to apply it to people and get such dramatic results on what are often recalcitrant problems. So people suffer with these things for years and can't talk their way out of them because they're below that.
Well, exactly.
I've
been a therapist for 20 years, and when I had a client fly to Colorado to get this done, and he came back so unstuck, so different, I could not believe it. And so that's when I knew that this is what I'd been waiting for as a therapist too.
So you were a therapist for 20 years, and do you do any of that now, or?
I do. Well, I pretty much do Cereset full time now because there's a therapist on every corner. But Cereset, there's not very many locations. But I feel like I am able to help my field greatly. Like my colleagues in the therapy world, when their clients are stuck and they just can't get anywhere, I say, please have them come do this. And then your therapy is going to help them so much more because they're going to be unstuck. They're not in that fight or flight hypervigilance. They're not shut down. Like they're able to take it in, I feel like.
I mean, and you've probably worked with hundreds of patients now. What's your success rate that you're seeing in hundreds of patients?
Well, I like to tell people it's kind of like that bell curve. And so you have people on one extreme, which I can count on one hand, that say that they saw little to no difference. And usually I can pinpoint why. One guy was smoking pot daily. That really doesn't work with this. Another had a severe mental disorder that wasn't disclosed when he started because we probably wouldn't have had him try it anyway. And then you've got people on the other end of the spectrum where this has absolutely changed their lives. Like they're just not even the same. But most people are somewhere in the middle where they see what we call a subtle but significant difference. Like things have changed and it matters for them. And, it helps them day to day. I've had several people make career decisions and changes after they got Cereset done. They just got clarity that they didn't have before, or, the fear of trying something new was gone. I don't know what it is actually, but that's happened several times. So we've seen about 350 people in the last 3.5 years.
That's awesome.
Yeah.
I know a percentage of them.
Okay.
And I had the similar bell-shaped response, but I've seen several just remarkable results. You mentioned the marijuana. Obviously, when you're doing Cereset, you have to do the right thing at that time. So you should avoid alcohol. You should get a good sleep. You should stay hydrated. You should get out in nature. And things your mom told you when you were 10, you have to give it a shot,
right?
Because you're going to undermine its ability to help you reset if you use neurotoxins, and alcohol is a neurotoxin. So you definitely need to abstain before and during the treatment especially.
And at that exit session, we also help clients come up with 3 action steps that are going to help them move toward what they really want. So if they're, for example, their issue was sleep, okay, let's come up with 3 action steps like sleep hygiene that's going to help you, help the Cereset work even better, or if they're another popular one is mood. I always give people the action step of starting to keep a gratitude journal, because we know that gratitude alone changes the brain. But you pair that with Cereset, which has already changed the brain, you're just going to get even better results.
Yeah, the gratitude journal is brilliant. And just, I think everybody needs to stop a little bit and just check a couple of those, because there's too many people so busy, they don't get around to that. I'm 58. I've seen a lot of that. You also mentioned to me earlier that it's a good time to start new habits. What do you mean by that?
Well, it creates neuroplasticity. Your brain is in an optimal position to just try new things. I think that's what they found. And so I have a lot of people who, pick that second language goal back up. They put the app on their phone and they're speaking 100 Spanish words in the next month, just things like that. They just, yeah.
I didn't think of that. That is so remarkable.
Yeah. So, Dr. Reynolds, thank you so much for sharing your expertise with us. I know this is going to help so many people that might have had reservations before. It's just going to bring peace of mind that, this really is a cutting edge, non-invasive technology that really can do nothing but help.
Well, I am happy to help. This is just an informed testimonial. I'm a neuroanesthesiologist who's seen it help a lot of people, and I was happy to come talk about things and go over just the fundamentals of how it works. There is a lot of jargon and terminology that could be confusing. So any way I can help, I'm happy to do so.
Okay, thank you. So if you or anyone you know is struggling with sleep, mood, energy, stress management, or thinking abilities like learning, memory, problem solving, and focus, please give us a call at Cereset Davidson, 704-533-2035.